Hi everyone, my name is Yi. I'm your host for Occupational Medicine Pearls podcast. This is the fourth entry into non-ionizing radiation, and I'm covering optical radiation this time. Optical radiation has the visible light and infrared radiation, or IR. Let's start with IR. So infrared radiation has A, B, and C based on their band, the wavelength. IRA is the deepest, it has the deepest tissue penetration and risk to our eye, lens, and retina. B can affect our skin. It has slightly longer wavelength, cornea and aqueous humor absorption, and IRC. RIR is from 3,000 nanometer to 1 millimeter. Surface skin cornea only can be affected. Where do they come from? So anything that is emitting light can emit or release the visible light and invisible light. So for infrared, you can't see it. You see visible light and it is usually really bright and it is accompanied by infrared. So from furnaces, molten metal, glass, foundries, kilns, smelters, infrared radiant heaters, and occasionally with laser sources, and if they are operating at near IR, if there is IR component of the welding arc, photocopiers, and incandescent lamps. How do they affect our health? So that because they are light, think about that it's going to interact with our eye and the skin. So with the eye, infrared cataract. It is called glass blower's cataract or furnace eye. Historically, it is due to chronic IRA exposure. It affects anterior cortical or posterior subcapsular length changes, classically found in glass blowers, steel workers. But these days, if you wear eye protection, they should not happen. If you look into IRB or C at high intensity, you can also get cornea burns. If people spend too close or too long with the high intensity, they may cause skin burns or retina thermal injury. And it also adds some degree of thermal load as an infrared source. So it is in the radiant heat. Classically, glass blowers, steel workers, foundry workers, welders, ceramic kiln operators, and smelter workers are at risk. How do we control? So for protecting the eye, it is easy. Our eye protection goggles should have eye absorbing reflecting filter lenses. So that's included in the welder helmet. It also protects from the UV as well. And if we stay away from that distance, that automatically reduces the impact. And we can also install reflective face shields. That's as much as important to know about the infrared. For the visible light has similar sources coming from any industry appliances, but they may also from high intensity arc lamps, xenon flash lamps, or welding arcs. So if you have someone welding, creating arcs, and if you look at them, that's visible light. So blue light has it at the wavelength 400 to 500 nanometer. It can cause photochemical retinal damage, and usually together with IRA thermal damage. So it may also cause flash blindness, and usually you can't see. So that's when you look into or when you without eye protection, that happens. All right, so this is very brief cover on the optical radiation, and I will continue on the laser.